So, as has been the case many, many times before now, and yet again, it's happening. Aaron Derfel, Gazette's health reporter, uncovering some. I was going to use the word shocking statistics. I'm not so sure this is as much shocking, Aaron, as it is one of those things that people look at and go, oh, I didn't know that's the kind of money you could make in the healthcare system as an administrator, but that's what we're finding out. So this is a new report on Quebec's top healthcare administrators. What did we find out?
Oh, well, the future CEO of Santé Quebec will be making more than 652,000, 100,000 more than previously reported, but also that the head of the McGill University Health Centre, Dr. Lucia Pachny, she's pulling in $402,000. And what I also discovered is that these administrators, many of whom are not doctors, or most of them who are not doctors, are making about $100,000 more than their counterparts in other ministries like finance or education.
I feel like the issue isn't the number figures as much as that we're not getting the bang for our buck, to put it bluntly. Like if they were doing a stupendous job and everything were working tickety-boo, I think we'd be like, great, pay them whatever we need to pay them to get the job done. Would you agree with me in that?
Absolutely. Okay. Yes, absolutely. So when you pay these administrators that kind of money, they have to deliver. They have to show results. And in the case of McGill University Health Centre, you recall that Lucia Pachny, who, by the way, she is a medical doctor, a specialist in internal medicine. So she worked at the NUHC and saw a full caseload of patients and worked really, really hard. She could make about $400,000 as well, given all the billings. But she was hired a year ago. And you look at the results right now, and you see that the wait lists are as high as they've ever been for elective surgery. Record ER overcrowding at the Royal Vic. Recently I wrote about a plan to revive, modernizing the Montreal General Hospital, but that's 2 decades too late. I know she inherited that dossier, but in the year that she's been a director, you can't say that there's been a radical turnaround. Although, as I said, she is impressive, and she's the first woman executive director of the McGill University Health Centre. That needs to be reported. And, her heart's in the workplace, but it's a lot of money, and taxpayers deserve results.
Mm-hmm. This keeps bringing us back to the same place. So, we're paying this other person who's going to eventually run Santé Quebec over $600,000, and I know that's a ton of money, and people look at that and go, wait a sec, that's crazy. But we also know that we spend more on healthcare than pretty much anything else in this province. And the argument, Aaron, and you've heard this argument, is that if you pay someone what the market is, what the market will bear in other places, unless you do rather, you're not going to attract that talent. So that's one argument. The other argument I would ask about, and I'm not defending, Dr. O'Patterney here, is how much, even as head of the MUHC, how much can you get done with a government in place that, has restrictions on to what you can get done? I mean, it's not as if she's running her own hospital and doesn't have to answer to anybody. Does that come into it?
Yes. So that's a good counter argument that you've made, Aaron. I think that the idea behind Santé Quebec is to cut the red tape, to allow these administrators, many of them, they hope to recruit from the private sector, to somehow run the system more efficiently. Right now, it's sclerotic, if you will, calcified, ossified. It's just congested, and it's hard to move anything. And there are the unions, and a big sticking point right now is this something called displacement, which would be to get some healthcare workers to transfer them when needed to other institutions that need them more. And there's resistance to that idea because you're talking about a work-life balance. There's a shortage of staff as it is, and so that's that big sticking point. That's why we haven't heard of late, any breakthroughs in negotiations with the Quebec Nurses Federation, the FIC. But to return to the compensation issue, when you look at the private sector, there are CEOs, and this is not healthcare, but in the private sector, they're making hundreds of millions of dollars, especially in the States. So what's a few $100,000? But I think in Quebec, what sticks out are these two issues. A lot of people, the average person, are finding it harder to buy groceries, pay the rent, or both. And they see these big numbers, and they see that our healthcare system is in a mess. So there's great, great frustration. And then, you look at the current government, they gave themselves a 30% raise.
Yeah.
The chief of staff of the premier, his salary went up significantly, went up by $70,000. He's making, I think, $301,000 right now, Martin Koskinen. And so that's where you get, these people who say that François Legault is out of touch. He doesn't understand the housing crisis. He doesn't understand the grocery crisis. He's not really doing anything to solve healthcare, but he's giving raises to his buddies.
Look,
Yeah.
That's what I think is resonating.
Sure,
And
the
the workers.
The optics are terrible. We've acknowledged that in the past. It's a pretty terrible time to have to be going through any of this. People look at it and they rightly, I think, appalled by looking at some of these numbers. My other question was, and I don't know if this is fair, she's making more, this is Dr. Lucio Paterny again, than her counterpart on the French side. Is that right?
Yes, by $100,000. But Frédéric Aubergel of the CHUM, and that's where you want to compare apples with apples. So he had come from the CIUS de Nord-de-Lille. He's not a medical doctor. Lucio Paterny is a medical specialist. She was an assistant deputy health minister in charge of hospitals during the pandemic. So she was able to negotiate something that was better. He's making $100,000, and she's making $70,000 more than her predecessor, Pierre Gefeller, who had a very generous housing allowance. And until Lucio Paterny came on the scene, he was the highest hospital-paid administrator. So, the McGill University Health Center is the largest hospital network. And so it might stand to reason, that the CEO of that hospital network should be paid the most. But, again, Feller was a family doctor, and he was making, with his housing bonus, about $330,000. And Lucia Paterny, with all the goodies, she's making $402,000.
Okay.
I mean, again, I'm going to circle back to what you said, Aaron, about the optics. And I'm just thinking about nurses still don't have a good deal. We have a shortage of doctors. These bureaucrats are making way more than the doctors in these roles that are so desperately needed are making. So this is a problem. And if we're trying to improve the system, I don't understand that that's not the starting point. I mean, you've got money to work with, allocate it better, and maybe the system will run better. Is it not that simple and straightforward,
Yes.
Aaron?
And I find, I looked into this a few years ago, and that disparity between these administrators in health, making $100,000 more, and it's gone up. So you've got 7 administrators who are making more than $300,000, and that's gone up from a few years ago, and none of the assistant deputy ministers in education and finance in these other ministries are making close to that. They're still making good money, $217,000, but nothing stratospheric like, 300. Dr. Luc Boileau, who's the chief public health officer, he's got a monthly housing allowance, and I think he's pulling in, $330,000.
Wow.
And you'll recall Horacio Arruda, he was, Luc Boileau's predecessor. You think like he handled the pandemic abysmally. They paid significant sums to help him deal with the media, and then he was replaced by Boileau, but he's still making something like $330,000. So
hold on. Horacio Arruda is still making that kind of money?
Yeah. Yeah, and no, he's doing well, and I'm just looking at the figures. I have the figures in front of me here. He's making $330,000 and $330,015 a year, plus he's got a $1,573 a month housing allowance.
What's his job now, Aaron?
No.
What is he doing?
Well, it says here he's sous-ministre adjointe prévention, promotion, planification et protection en santé publique. So he's in charge of what are 4 P's: prevention, promotion, planning, and protection.
So where is he? How come we never see him anymore?
Well, he's in Quebec City. They at a certain point he was. You'll recall he started flubbing and backtracking. And,
yeah, sure.
And so they found a job for him, and he's, as I said, in charge of prevention, promotion, planning, and protection.
Out of sight, out of mind. And
but here's a whole whack of money.
A year. Wow.
No, I'm just saying no to this. No.
Aaron, we got to wrap up. I wonder what will come of this. I can't imagine a whole lot unless we start hearing on the French side. But as you said, the administrator on the French side is not a doctor. The one on the English side actually is. So maybe there's something to be sort of taken into account there. I will ask, though, it seems to me, from Dr. Gefeller to Dr. O'Patterney, $70,000 more for the next person to run it than the person before. That seems kind of extreme as well. But then again, what do I know?
Yeah, and something I didn't point out, but Quebec has all these delegates to Boston and Houston, and they're paying them. In Los Angeles, they're paying them all kinds of bonuses. So this is like, Quebec has its Ministère des Relations Internationales, so they're paying these delegates to stay in Paris, to stay in Rome, and as I said, Los Angeles, Houston, and Atlanta.
All in the healthcare system?
No. Oh. That's a different ministry.
Okay.
But that's ostensibly, to polish Quebec's image abroad. So Quebec has a delegate in who works for the Ministère des Relations Internationales, and he's a delegate for Quebec and Atlanta, and he's pulling in $170,000. Plus, he's got a bonus of he's got a housing bonus of $67,000. Plus, he has expenses of $33,900.
Yeah. Well, I was worried when I thought you were going to tell me all these people are somehow in the health system. At least they're not in the health. I'm not saying it's any better, but international relations, different story. Aaron, I got to wrap up. Do you have any idea, by the way, why our health minister showed up at the Lakeshore over the weekend? Surprise visit?
Oh, I think he to give him some credit. He wants results. He's putting pressure on Dan Gabay, who's the new CEO of the West Island Health Authority. But some people are also saying it was a good PR stunt.
Okay.
You be the judge.
All right. Aaron Derfel of the Montreal Gazette. Aaron, thank you. Appreciate it.
My pleasure.
Take care.